Summertime is hard on all of us. The heat and dare I even say humidity in Utah the last few days. It's tough on all of us, but especially if you're pregnant. Joining us right now is Dr. Karen Gibbons with the University of Utah Hospital to help answer a few questions for our pregnant friends out there. Thanks so much for coming in.
Thanks for having me.
I think pregnancy is tough no matter what, but it gets a lot harder in the summertime. You just feel kind of miserable.
Absolutely.
Do you have tips for moms to maybe feel a little more comfortable and happy about having a big bump on them?
I think really the most important thing is to remember to keep hydrated as much as you possibly can. The more water, the better. Not only is that going to help keep you cool, it's also going to help you keep from having those contractions that can stir up when you get dehydrated and hot in the summer.
And do you see that sometimes moms coming in thinking that they're going into labor?
Absolutely, and of course we are always happy to check that out, see them in triage, make sure that everything's okay, but 9 times out of 10 in the summer, it's going to be a bit of dehydration, so definitely keep water on board.
Perfect. We want to talk a little bit about foods too, because there's foods that we know you're supposed to avoid when you're pregnant, but it seems like that's what's available and around oftentimes in the summertime. Absolutely.
You're going to a lot of picnic lunches and celebrating things like the 4th of July. You're going to have lunch meat around, which you definitely want to avoid. When you're trying to do cool meals, things like sushi are going to be around more often. You want to avoid that. Raw foods in general are not so safe in pregnancy. And then just keep good food hygiene. Stay away from the things that have been out in the sun, the potato salad. Make sure that everything's prepared correctly.
So all the things we know normally in life, but even more important when you're carrying a little one along with you.
Exactly. The risks are always higher.
Perfect. Let's talk a little bit about travel too, because I know that moms always have questions about whether they can go on that summer vacation with the family or when it's time to just stay home and relax a little.
Absolutely. The truth is, listen to your body. Your body's going to tell you what you can and can't do, or the airlines may tell you what you can and can't do. Check with your carrier before getting on the plane. Everybody has a different cutoff, usually around 35, 36 weeks. If you are going to be doing long flights or car trips, make sure that you schedule in breaks to move around. Pregnancy is a time when you're at a higher risk for a blood clot, so making sure that you get little bits of walking in and things like that.
What's the biggest concern that moms come in with that you see more maybe in the summertime than you do the rest of the year?
I think they notice they're swelling more. So things like getting your feet up above the level of your heart to make the swelling in your feet go down if possible is going to be helpful. And again, just staying hydrated.
Those ankles, they're rough.
They are. They are.
You think the only thing that's going to fit you when you're pregnant are your shoes, and then those ankles swell up.
Go up a half to a full size, absolutely.
All right, so that's normal?
That's totally normal.
Okay, I wasn't a freak show.
No.
Doctor, thanks so much for coming in and answering our questions today.